I would like to address two more topics, though. And the one thing is, of course, the update of the TBI, because you mentioned the beauty of artificial intelligence is that you can always improve. And you sent a few slides there, Renato. But I don't want to leave out the topic of post-LASIK ectasia evaluation, or the how to analyze the stability post-LASIK, which Riccardo has done beautiful work. So yeah, this would be, I think, the last two topics for this webinar. So Renato, perhaps you can quickly go over the current status of the update of the TBI.
Yes, it's not going to take more than a minute. If you change to the next slide, the beauty of artificial intelligence to go beyond but not over and take the advantage of more data. So we have more. If you go to the next slide, you have the numbers, I think. Yes. So we have 543 cases with VAE. Some of them are not in the strict criteria. We are going to separate them. But once we have more data, we will be able to get more information and train better the system. So next, we have in the population, the Ds are very normal. The enhanced AI next, big data. It's not exactly the big data, but the bigger data. And that was a very important work from my colleagues on the brain, that we trained with 90% and did the testing in 10%. We did the normal versus all cases, and also normal versus VAE and T, and look at many of the parameters that would be candidates. Next. And here, the concept is that we came with, you can click next again, with a new function that is even better for the true disease. We have from 98.4 to 99 in the sensitivity, and also 98.5 to 99.2 on specificity. But it increases the specificity, even though some of the cases are going in the higher direction. So we are probably, if you see in the graph on your left, go back please, the few cases on the green that are very high here, probably those are the susceptible cases. But if you go to the next click, you see the improvement from 75.7% to 85.6%. And some of these cases are still cases that are unilateral ectasia, not keratoconus, in which the fellow eye of the patient has everything normal, but the ectasia eye got ectatic because of a secondary trauma like eye rubbing, which is still something that we believe to be the case for these cases. But the convergence of genetics and this will be the future. So the future to come is that the TBI is the best parameter and will be even better very soon.
Yeah, very nice. So the more data we have, the more we can learn. The topic you just addressed, also Shizuka sent some information because she has done beautiful longitudinal work on these cases which did not progress. So the concept of true unilateral cases you mentioned, but I think that you could probably discuss for another 30 minutes just about this topic. But yeah, I think the main message for the attendees should be the more data we have, the more we can learn, and the higher the accuracy will be in future. Because I think you all agree, no index will probably can ever be perfect.
Yes. Yes.
Yeah. And in terms of this artificial intelligence, some comments from the others before we move on to the last topic, to the post-LASIK analysis or post-LVC analysis. Do you want to comment on these studies, Professor Zhou, perhaps?
All the 100,000 the keratoconus. So I think AI for keratoconus screen is promising. Renato had a great job. I love to join your lab as I also have a large volumes of keratoconus, more than 3,000 keratoconus, and I already performed the cross-linking for more than 3,000 keratoconus. So if it's possible to join to provide some data or cooperate something else. Thank you very much. Thank you.
Professor Zhou, this was, I think, a perfect comment, because I think that fits also to the topic for today. Corneal biomechanics meets tomography around the world, because it's so beautiful that the whole community increased so much over the past years, and more people agreed on combining the data. And one concept we really wanted to do as a next step was to integrate data based on ethnical differences, and especially, of course, including data from China, and it would be very, very nice. And yeah, Riccardo can comment on this topic as well.
Yes, well, of course, including technical data is absolutely important, because even actually we were quite amazed, because the CBI and the TBI somehow were created mostly with Caucasian subjects, but they are working quite well in also other populations, and it was externally validated. But it will be really good if we can improve these indices with the inclusion of many more patients coming from Asia, from Africa, and the rest of the world, because I'm sure we can improve them.